And welcome into To Your Health. You know, if you live in the South, occasionally you're going to start saying, I feel a little bit stuffy up here in this part of my head. And you may realize the fact that it could be allergies. And we talk about different times of the year when they can really bother us. And a lot of times you may be having problems with your sinus. And today we have with us Dr. Stephen Chandler. And Dr. Chandler, you are a physician and a surgeon. Specialty is, of course, sinuses and ears, all this area.
Correct, yes. Otolaryngology is the official term, but ENT works just fine.
Works just fine. I think that's what most of our viewers are used to.
Right,
I'm going to my ENT doctor. It's the way it used to be. Basically, we were talking about the sinuses, and how does a person generally know that they're having problems with their sinuses?
Right. There's a constellation of symptoms that people often present with, and one of the hallmarks is nasal obstruction, nasal congestion. That often will evolve into facial pressure, headache, and oftentimes yellow-green drainage, either out the front of the nose or down the back. Coughing, people can end up with bronchitis, exacerbations or worsening of their existing asthma. Allergy plays a significant role in this whole process, but oftentimes the whole ball is kicked off by something as simple as an upper respiratory tract infection or common cold.
And so then basically what's happening is the infection is just setting itself right into the sinus area. Exactly.
There's a difference between the nasal cavity, where people will breathe through, and the sinuses that are around the nose. That's what gets infected, and that's the source of the pressure, the pain, and the pulsations that people will get when they're infected.
And then normally when a person is having these problems, obviously they start with their general practice doctor. They go there and say, Doc, I'm not feeling good, I got all this stuffiness. And then they'll basically maybe look at you and say, well, we probably need to get you into a specialty, and that's where we get into your area there.
Exactly, and the vast majority of the early types of sinus infections are treated by the primary care physicians. And you know, it's always our approach to try to do the least amount to get the patient well. We want to use the most conservative measures available to us, and that includes things like nasal decongestants, antihistamine medications, and as things progress, if things are worse, we'll often prescribe antibiotics and steroids. That pretty much is the end point for most primary care physicians in terms of managing this disease, and we often get them when they have a progression of a disease that they just can't handle anymore. So that's divided into two populations of people who either have chronic, all the time nasal obstruction or chronic infections versus people who have recurrent, acute, or frequent sinus infections. They'll get an infection, it'll get treated, it'll get better. Shortly thereafter, they'll get another infection. Right. So they're kind of distinct populations, and the way things have evolved, it's very easy for us to determine the nature of what's going on based on the patient's history, the response to treatment, and one of the most important aspects of my practice is imaging, and that's a CAT scan of the sinuses. It's very precise, and it gives a tremendous amount of information about the nature of the pathology and the anatomy that is an underlying predisposition often.
So basically when you've exhausted the basic medicines and those types of treatment, then the next step would be you have to do something surgically?
Oftentimes that's the case. You know, we really do leave it up to the patients to make the decision. We are simply guides to along the pathway of what's currently available, you know. So once we've exhausted any type of medical measures and the patients are symptomatic, and we have evidence to support a predisposition on imaging, they're just not better, that's when we venture into the surgical realm. And we live in a time when we have a tremendous amount of very innovative techniques to manage this disease.
Well, what we're going to do is we're running a little bit out of time on this segment. I'm going to have you come back again next week, and we're going to talk about some of the procedures or the actual, because a lot of the things now are being done right in your office as opposed to having to be done in the surgical suite.
Yeah, the surgical forum has always been the most protected, privileged environment, and the safest environment often. However, the use of the operating room is becoming less and less necessary now because we have excellent capabilities of anesthetizing the nose, and patients often don't want to take the time off of work to undergo that type of surgical procedure with the inherent risks of general anesthesia. So yes, we're transitioning much more toward in-office procedures, and that includes using balloon dilation of the sinuses.
Good. We're going to get you to come back next week. We'll take care of that. Remember, as Dr. Chandler said, if you're having a problem in the sinus area, there are different ways of treating it. But the main thing, if it becomes aggravating or if it's a consistent thing happening, you probably do need to look at some special treatment. And we'll be right back right after this.